My name is Carrie Walsh, and I'm one of the Harvard Emergency Ultrasound Fellows. I am also an attending physician in emergency medicine at Massachusetts General Hospital and the Brigham and Women's Hospital in Boston. And I have the pleasure today of speaking with Dr. Nate Lightfoot, who is a vascular neurologist and a neurohospitalist at St. Luke's Hospitals in Kansas City, Missouri. Dr. Lightfoot did his neurology residency at Georgetown University Hospital and his vascular neurology fellowship at the NIH. Dr. Lightfoot's talk at WinFocus 24 will be on brain parenchymal assessment in stroke. So, Dr. Lightfoot, please tell us a little bit about how you look at the brain with ultrasound.
Yeah, so intracranial ultrasound or ultrasounding the brain is not a very commonly performed diagnostic study. Its real only common clinical application is with TCDs, transcranial Dopplers looking for vasospasm in the setting of subarachnoid hemorrhage. Um, but, kind of expanding on that and using brightness mode or B mode with the ultrasound, you're actually able through the window in the temporal bone. It's thin enough that you can actually ultrasound the parenchyma of the brain or parenchyma in the brain, and then also any pathology occurring in the brain you can see with the ultrasound. And so we've kind of, with that idea, moved forward and performed a lot of ultrasounds on patients who've actually had a hemorrhagic stroke.
Hmm.
And we've found that, it can pretty reliably diagnose a hemorrhagic stroke. And, this has a lot of application, whether before the hospital or in the hospital while you're monitoring the patient. It has a lot of application in that area and even the potential to expand to other pathologies which happen in.
That's incredible. So, is it that it looks different on the ultrasound? How is it able to see that?
Yeah, so using B mode, typically the natural thickness of the brain leads to its inability to be insulated. But with B mode ultrasound, depending on the thickness of the skull in the patient, sometimes you can get a good view of the brain. And
That's
so you could see some simple structures like the ventricles and the soul side of the brain, as well as midline structures, and also get an idea of the CSF spaces as well, too.
great. And is there a certain area of like bleeding within the brain that's easier to see?
Yeah, definitely. So the more acute, the easier it is to be seen usually. Also, if it's supratentorial, because that's just a little easier to catch on the ultrasound, it's difficult to insinate, through the base of the skull. So definitely supratentorial, and the closer to onset, the easier it is to ultrasound.
That's incredible. I can imagine it would be very useful in the trauma bay where the patient's too unstable to get to CT, just having some kind of idea what's going on. So, is your research in this as well?
Yeah, so we're doing research into that. Basically, we were ultrasounding patients in the emergency department who came with stroke-like symptoms, and several of them did have actually hemorrhagic stroke, and some didn't. So we're actually able to catch a wide variety of brain pathology. But most reliably, we were able to find hemorrhagic strokes. And so what we're kind of pursuing now, myself and Dr. Arti Sarwal, who's kind of been my ultrasound mentor, is creating an atlas of intracranial ultrasound findings on B mode. That way, kind of to lay a foundation for intracranial ultrasound for which others can expand upon and to be used as a reference.